This is Andrew Sun, president of Heritage University. As you all know, we're living very difficult times because of the spread of the coronavirus. We all wish our students were here right now. We were all taking classes, sharing our time together in the cafeteria, going to the library. However, we have very restricted access right now because we're following the mandate of the state, as well as we are concerned about your health, about the health of our students, our staff, and faculty. That's why we took the very difficult decision of moving to a remote environment to deliver our courses. And we know that this is going to create difficulties. However, it's also our intent to make sure that we find ways in which you can continue with your coursework so that you are successful this semester and you're not delayed with a path to a degree so that you can become professionals in this valley and beyond. What we are going to do now is we're going to do a few Facebook Live sessions so that we can provide information to you about what's going on at Heritage, that hopefully this can help you. It's also an opportunity for you to ask questions to us and perhaps give us suggestions on how we can improve our communication with you. The most important thing we can do is to keep communication open with our students, our staff, and our faculty so that we all know what we're doing and we make sure that we can complete the spring semester with all our students successfully reaching their academic goals. Today, our first Facebook Live session is about the coronavirus itself and its spread, and perhaps you still have questions about what you should be doing as individuals in your homes, with your families, with your friends, to avoid catching the virus or being in situations where you may spread it to other people. And for that purpose, we are very lucky at Heritage University to have Dr. Christina Nyirati. She's the chair of the nursing department, and many of you know her as such. However, not only is she the chair of the nursing department, she's also an expert in infectious diseases and how to prevent them. So today she's going to give you some information about the coronavirus, and also she will be able to answer questions you may have about this so that we can all become better educated on how to avoid catching this very, very dangerous disease that is hitting our entire nation. Indeed, it's hitting the whole world. So now I would like to welcome Dr. Nyirati, and for that I'm going to step out of the camera, and I really look forward myself, I know you do too, to the words of wisdom she's going to provide for us. Thank you.
Thank you, Dr. Sund. As Dr. Sund was telling you, I know a lot about infectious diseases. That's because I'm really a public health nurse. So I'd like you to think about understanding the context that I'm going to be giving you information has to do with how you can protect yourselves, how you can protect your family, how you can contribute to protecting the heritage community. The coronavirus first appeared, this strain of the coronavirus first appeared in 2019 in China. The reason that it's called a coronavirus is because when people are able to look at the way the virus is shaped, it is shaped like little spikes that look like crowns, and those help the little virus to become embedded and infect tissues. We really don't know a whole lot about the coronavirus yet. The World Health Organization and a lot of private laboratories all over the world are trying to investigate more about it. Because we don't know a lot about it, there's new science coming out every single day. And you might wonder, how come I heard this yesterday, but I hear this today? And that's because the scientists are working very quickly to get new understanding and new knowledge about this virus. The important thing to understand is that this is very serious. There should not be any minimization of how serious this disease is. You need to be aware all the time about taking care of yourself, taking care of people that you love and your families. People who are at greatest risk are not really in the age groups of most of our students. Most of our students are under the age of 50, and the greatest risk is to people who are over 60, but also people who have a history of chronic illness. So if you or anyone in your family has diabetes or respiratory problems such as asthma or heart disease, anybody who's immune suppressed, and anyone who's over the age of 60. These are the people who are the most likely to become very sick from this virus. As of late yesterday evening in the state of Washington, there were 904 confirmed cases of the virus, and there have been 48 deaths so far. Well, actually, this morning, as of this morning, there was a 49th death. The problem with the virus right now is that there has been no good ways of screening for the virus until very recently. And the screening and diagnostic kits that are available have been hard to get availability for. This is going to change very quickly, as you may have been watching the press conferences from Dr. Fauci, who is the expert on the coronavirus right now. He's been on the television a lot and on the radio. He's a good person to listen to. He really knows what he's talking about. You can take my word for it if you can believe what I'm telling you. So in the next couple of weeks, there's going to be more widespread availability. We think about an incubation period, which is the time between getting exposed to the virus and the time that you have your first symptoms. This is why this is important. You actually could have the virus after getting exposed to it without knowing that you have it. That's because it takes time for the symptoms of the illness to develop. And so you really need to be careful to isolate yourself if you think that you might have the virus from other people, if you think you've been exposed to the virus. But in general, right now, we have a mandate from our governor, and we need to be staying away from each other because of this problem with the incubation period, which can last between 2 days to 14 days. It can be as long as 14 days after exposure that you know that you have the virus. It is important for you to stay away from others. You should maintain a distance of at least 6 feet from everyone, including people in your family. This is not the time to be going to social gatherings. It's important for you to stay home. If you have to go to the grocery store, go in, get the things that you need, and go home. Right now, it's important for you to stay home as much as possible. If you know this means a real change in our day-to-day living patterns, and that's very difficult. We are used to being able to go to church, to other social events, to meet friends and family members at restaurants or at dances or at clubs or at the bar. It's really the time to stay home. There has been some mandated closure of restaurants in many places in the state of Washington, and we now have a national suggestion that we should not be ever in a group of people that has more than 10 people in it, and even then to maintain a distance of 10 feet. So, what are some of the signs and symptoms? Fever, cough, muscle aches, fatigue, and shortness of breath. It's less common, but you might have a sore throat, cough and spitting up sputum, which is that stuff that comes from deep down in your chest, and a headache, and you might have diarrhea. The one thing that you might not have been hearing from the news that you've been listening to on the TV and the radio is that there also is some incubation of the virus in stool. So it's very, very important to know that you could have some diarrhea. That's also another symptom. So what should you do if you notice that you have these symptoms, or if a family member or someone you love has these symptoms? Well, you should contact your care provider. Instead of going to the emergency room or going to your care provider's office, you should call. Call, and there usually are nurses on a triage line who will instruct you about exactly what to do. Unlike other problems in the past where this is not widespread or so highly contagious or so dangerous, you could just go right into the emergency room or to your care provider's office. But now everybody has to protect everybody else. So you will get specific instructions about how to come and when to come. There are many physicians' offices that are scheduling people very tightly so that they won't be sitting in a waiting room, either in the emergency room or the doctor's office, but they will schedule you so that you can just come in and be seen without sitting there and spreading your virus to other people if you think you have it. What else can you do to prevent this? Well, doing very frequent cleaning and disinfecting of surfaces is very important. Cleaning means getting rid of surface dirt that you can see with your eyes with soap and water, and then following up cleaning with disinfecting. Disinfecting, the best disinfectant for surfaces like tabletops and in your kitchen, on the kitchen tops, is bleach water. If you just take a gallon of water and put a third of a cup of bleach in it, it's inexpensive, it's easily available, and it is the most effective way to disinfect. It doesn't kill everything, but it lowers the amount of the virus enough so that the likelihood of being colonized with the virus is going to be a lot less. For those things that you can't use bleach on, like plastics, it's best to use alcohol that has at least some kind of an alcohol solution that's at least 60% alcohol. Washing your hands frequently is the best way for you to prevent giving yourself the virus. And that means washing it with soap and water. We are embedding the recently made World Health Organization method of hand washing onto this Facebook page so that you'll be able to see it. Hand washing with soap and water is really superior to using alcohol-based rubs that you can get. Those are really second best. The first best is using hand washing with hot water and soap. And you'll see the video if you log on to it after I get done with this live interactive video that we're making for you. But in general, you're going to use 20 to 30 seconds of friction and rinse and dry with a paper towel, and use a clean paper towel to turn off the faucet if you don't have a kind of a faucet where it just automatically turns on and off. The alcohol hand gels can be used, they're best used when the hands are not visibly soiled, but they really are not as effective as hand washing. You should wash your hands frequently after touching surfaces and touching other people. Now is not the time to be shaking hands or being physically close to others. I've seen people do elbow bumps. Even fist pumps are not good right now. You can do a namaste like this, Or you can do toe touches. That's kind of an intimate way to let people know that you're thinking about them when you greet them and you're happy to see them. And a good, happy smile, it might be the best way. Stay away from hugging and being close to people. People ask all the time about face masks. Face masks really are better if people have a virus. They're better at keeping transmission of the virus to other people. They're not that good at keeping yourself from getting a virus. So actually the best type of face mask are the ones that are impossible to get right now. They are a specially fit face mask. And they're the ones that people in hospitals and in clinics use to protect themselves against getting viruses and bacteria. Those are specially fit face masks, and they're very hard to obtain. There have been some stories about people going to hospitals and stealing face masks, and I know that that's something that Heritage University students would never do. Respiratory droplets are the way in which you are going to either get the virus or spread it to others. So if someone coughs or sneezes and then places their hands on a surface like a banister, stairway banister, or on a surface, and then takes their hands away, then that virus is living there. And it will live there for up to 72 hours without disinfecting. So you can pick it up by touching that same surface, and then when you touch your face, especially if you touch around your eyes or your nose, the virus will easily migrate then into the mucous membranes of your eyes and your nose, and it will quickly start colonizing. That means it'll start growing at a very rapid rate in your body and can get to your respiratory system. This can cause a very severe problem with breathing. This is the most severe problem. Most people who are very sick become sick with a pneumonia-like problem, which means that the virus gets down into the little teeny tiny sacs in the lungs. Those are called alveoli. And the virus spreads in there and causes those sacs in the lungs to become diseased and inflamed. And then pretty soon, those little sacs are filled up with fluid and mucus, and there can be no exchange of oxygen. So people who get very sick get sick with two problems. The first one can be that the virus actually spreads to the rest of the body in a problem called septicemia, and it infects the rest of the body, and people are very, very sick. The other thing that happens is that from lack of oxygen exchange, the person can die from lack of oxygen. Every cell in your body needs to have oxygen in every moment in order to live and do its work. And when that oxygen becomes unavailable, then the person can die. And that is how we now have 49 people in the state of Washington who have died. I neglected to tell you when I gave you the daily report. I do get the daily report from the health department on cases and deaths. There now are 4 confirmed cases of the virus right here in Yakima. So it's right here with us. And everyone who is in healthcare feels pretty confident that when testing becomes more widespread, that we will have more diagnoses of this virus. So the question is now, can you spread the virus without being sick? Oh, yes. Remember we talked about how there is an incubation period. And so during that 2 to 14 days, you can spread the virus without even knowing that you're sick, because you might not have come down with the illness yet. You can begin to bring in your questions now, and I think that we might have some already. And Dr. Hill is going to relay those questions to me, and then we'll proceed by answering your questions.
Yeah, so thank you so much. This is great information. So there's a few folks I know we're already up to, I think, 45 some views. So and we've got now more folks are adding. We apologize first and foremost for some of the technical difficulties as we learn this new platform and all traverse these new this new reality that we're all experiencing. So if you have any questions, we would be happy to take some questions now. Is it safe to sign up for the coronavirus trials taking place is one of our questions.
Okay, and I think that when you talk about the coronavirus trials, you might be talking about the vaccine trials. So I'm going to assume that that's what you mean. There are 3 large companies in the United States who are trying to develop clinical trials for a coronavirus vaccine. Usually the FDA requires many steps before human testing of any vaccine. For the coronavirus, there likely is going to be what we call an accelerated process, where the time to do animal testing is going to be minimized, and then there will be more rapid delivery of testing of the coronavirus vaccine to human beings. I am not sure whether or not how widespread that's going to be. I just believe that there will be specific guidelines about who should and should not be part of the human testing phase of the vaccine. So I would trust that the scientists who are going to be doing the vaccine testing will have important ways of screening out anybody who could be at risk from getting sick from the vaccine.
Another question, how about can we catch the coronavirus from eating certain types of food, and how long does it live on surfaces?
Okay, it lives on surfaces for 72 hours. There's a paper that's going to be published probably by Friday from the New England Journal of Medicine. And so that's why it's important to frequently clean and disinfect surfaces. Foods, there is some thought that your gastric juices minimize the amount of colonization that your body can get from the coronavirus. So it's probably safe to eat most foods, but then people who are immune compromised may actually have a problem with getting colonized.
Can you tell us a little bit about the difference in age and what you mean by immune compromised, and if healthy people don't have it, should they still go out? Why the kind of hysteria for particularly those of us who are, no, not me, but those of us who are younger?
Sure. I understand when you're young, it's hard to believe that something this bad could be going on. So let me put this in perspective. There have been 2 very, very serious viral illnesses that have affected people. Most of our students probably don't, your grandparents might even still be too young, but my grandparents remember the flu outbreak of 1918. It was the Spanish flu, and it wiped out millions of people all over the world. I know that in my own family, my father lost 4 of his siblings from the Spanish flu. He was 4 years old, and he lost his baby sister and his older siblings. And his mother was very sick, but she recovered. If you ask your grandparents, and they will remember the stories that their parents and their grandparents taught them. This is a very, very serious virus, and those of us who are healthy we can be colonized with the virus without getting very sick. So remember that you can get the virus, it can live inside of your respiratory tract, and you might have no symptoms at all. You might even develop only mild cold symptoms, but you will be able to spread the virus to other people. So while you might be feeling pretty good most of the time, this is about us as a big community and how we must protect each other. So keep that mostly in mind.
Excellent. And can you explain the differences between the similarities about the flu and Corona-19?
Okay. So here are some of the things about coronavirus 19 and the flu. The biggest difference between the two in terms of how a public health nurse like me thinks about it is this. We have a vaccine for the flu virus. There are many strains of the flu virus, as there are many strains of the coronavirus. The coronavirus usually does not cause this serious amount of illness. It can be one of the viruses that is responsible for a common mild cold. So we do not have a vaccine for the coronavirus. We do have vaccine for the many strains of the flu virus, which is one of the reasons that we've been able to have worldwide control. So that's the main difference between the viruses in terms of public health thinking and the spread.
Are children, babies, and pregnant women also at high risk? And what precautions should they take?
Okay. It's very interesting. Children can get the virus, but for some reason, and babies too, for some reason that the scientists cannot yet understand, they do not become as sick as people who are older. The older people are, the more likelihood they are going to be to not have the amount of immunity in their bodies to fight off the virus. So I want to go back for a moment because I don't think that I answered the question that was asked about what does it mean to be immune compromised. So when you are born with the ability eventually, very early in your life, to mount a big internal defense against foreign things that could be infecting your body. But as you grow older, the ability to reactivate all of those things that your body has been building up against disease for your whole life, that becomes lessened. And so that's why older people are more likely to be immune. That means that their immune systems become compromised. That means they don't work as well. But other people with illnesses, chronic illnesses, are also immune compromised. People with diabetes, people with chronic asthma or chronic cigarette smokers. We know that cigarette smoking paralyzes some of the first defenses against immunity, so it's why it's not a good idea to smoke. Pregnant women are not as hearty. Their immune systems don't work as well as people who are not pregnant. And so pregnant women need to take extra special caution to stay away from people who could potentially be infected. And we don't know yet about little teeny tiny babies who are under 28 days of age, but it seems like infants who are older than a month old are more like young children. They don't have as much of a risk of getting seriously ill from this coronavirus.
We have some of our students that are still working in healthcare professions and in hospitals. And so this is a very specific question. You, I'm sure, will have some additional things to add to it. But how do we prevent becoming Typhoid Mary as healthcare professionals? So it sounds like a lesson.
Typhoid Mary is a person who took care of the sick. And she had typhoid, which is a very serious illness, and ended up spreading it to hundreds and hundreds of people, and they got sick and died from it. So what can our students who are healthcare professional students or who are working in healthcare even when they're not in a student role. You need to make sure that you are following the procedures in the healthcare places where you are for how to protect yourself. And every place has very strict isolation procedures, disinfecting procedures, and we who are in the healthcare industry can't quit. We have to be there. We have to be able to be there to take care of the sick. But we need to follow every precaution that is scientifically based in order to do it.
Dr. Nyirati, a different question. Can you use other household products such as white vinegar, and as a cleansing agent to disinfect things around the home?
Okay, white vinegar is a very good cleaning agent, but it's not a good disinfecting agent. It can actually remove surface dirt, and it would be one of those cleaners that you can use to rub down a surface first before you use a disinfectant like bleach.
I have another question, and this one I'm glad you're still in the room, Dr. Sun. This is really for President Sun. Is Heritage University planning on closing campus to prevent the coronavirus spread to protect staff and faculty?
Right now, we are working on the plan that we presented last week, where we're practicing social distancing, and that's why classes will be held remotely. And we're encouraging staff and faculty that can work from home to do so, but we're not closing campus yet. However, we are evaluating this day to day, and if the recommendation comes from health authorities in the state of Washington or at the federal level, that is a possibility. It's not a welcome possibility because it would make it harder for us to be able to deliver academic coursework to our students. But it's definitely something that it's in the realm of possibilities. Right now, to repeat, we are following the recommendations and the mandates of the state and the federal government, and we believe we are doing a good job of maintaining the protocols of social distancing, which is to be 6 feet apart from everybody and try not to be at work if you don't have to. And of course, don't come to work if you're feeling sick and have symptoms that are consistent with the coronavirus. So this changes every day, and we will inform staff, faculty, and students of any changes that happen on a daily basis. But right now, we are still open as a university. Our offices are open, and we are practicing the protocols of social distancing.
And then Christina, can you elaborate a little bit on social distancing, just to make sure that we all kind of have an understanding of really what does that mean and what does that look like in practice?
Okay, social distancing means a couple of things. Number one, staying home is one way of social distancing. Staying in the environment where you are going to be living most of the time. The other thing is, if you must be in a group of people, if you take your arm and send it out, and if the person next to you takes their arm and send it out, your fingertips should not be touching. And then take another step over apart. That will put you 6 feet apart. And we know that that's the distance at which the virus will not travel. If someone happens to cough or sneeze or breathe, everybody's got to breathe all the time. It's not going to travel farther than that. And I want to say something about social distancing. This is an important issue in relation to feeling socially isolated. You need to make sure that you are staying in touch with people in as many ways as you possibly can, by phone, by email, by texting, by all of the electronic means that we have of staying in touch with each other. And it's important for you to express your sentiments of care for one another at this time. Make sure that you express appreciation and let people know. It will make a huge difference in people's emotional ability to gather their emotional resources together.
There is another question, Dr. Nyirati, that is perhaps not as nursing related, but it's still important. When people gather in the grocery market to buy toilet paper, water, etc., is that helping prevent the coronavirus?
Is toilet paper and water helping to prevent no one seems to be able to understand why people are buying so much toilet paper. I think that it might be helping people's moods to have those things, but does it help to prevent it? It actually could be promoting the spread of the coronavirus if people are going out and crowding the stores in order to get those things.
Good question here on, should people who are having elective procedures, should they reschedule them?
Yes. If you're having elective surgery or other procedures, actually the Centers for Disease Control has requested that people who are performing elective procedures postpone them. We do have a shortage of hospital beds in the United States. And we have a shortage particularly of acute care beds where people are very sick. So it's a good idea to postpone elective procedures.
Can you differentiate between the symptoms of COVID-19, the flu, and the common cold?
Well, the symptoms of all three of those are very similar. And this is why you really can't know unless someone screens you or diagnoses you with an accurate test. Since we have had a problem with the availability of accurate COVID testing, I know that there are people who have been getting screened for the flu virus, and there is good testing for the diagnosis of the flu virus. There's good screening testing for strep throat. There's not good testing for the common cold. So most physicians and other health providers have been doing a diagnosis by elimination. But very soon, probably within the next week, the viral test for COVID virus is going to be more available. It is not, despite what we have heard from some people at press conferences, it is not necessarily available yet.
I got a question, I think, for Dr. Sun, but possibly also for you. We want to know what resources are available to students right now, now that everything is going online. I know we've got some plans in the works, but...
Yeah, well, I believe there may be two aspects to this question, and what resources do we have for our students now that everything's going online? For academic purposes, I think the best answer at this point is to say that we will be communicating these to you through the next few days. We will plan another Facebook live session specifically on online learning. Also, you will be receiving emails and other forms of communication from your faculty, and we will make sure that all students know what we're doing to permit you to be successful in the online learning environment. However, Dr. Nyirati, maybe you can explain a little more what resources we have health-wise, or where we can refer people now that we are not face-to-face.
Mm-hmm. If our students need health services, I understand that we have students who might not have health insurance or who might have difficulty accessing health care. The best advice that I can give you is, I know that Farm Workers Clinic is devoted to making sure that everyone in the Lower Valley has access to care. If you call them, they will have a patient navigator or someone who will help you to get signed up for some sort of health care so that you can be seen. Please do not delay getting health care just because you don't have health insurance. There are a lot of people who are afraid that they're going to get stuck with a bill for thousands and thousands of dollars. As I said, call Farm Workers Clinic first. I'm a patient there myself, I get excellent care because I know that they have many different compassionate care packages. And that includes for people who are undocumented. If you do not have any kind of documentation, you can go to farm workers and you can feel safe that people will keep your identity private.
What about the being just in the same room? So questions here just about how easily does a virus spread by breathing it in, having someone in the same room?
Okay.
Yeah, can you tell us
Just
a
if
little
the
bit about
infected person is only breathing, not sneezing or something.
You should not be in the same room with someone who has any of the coronavirus symptoms. So if you are in your home and someone has a sneeze or a cough, even if they're not diagnosed with coronavirus, because we don't have a good way of diagnosing people completely yet, they should be isolated in their own room. If you are in a social situation with someone who has symptoms of coughing or sneezing or runny nose, runny eyes, or their eyes are running with water, that person should not be in that room. That person needs to be isolated at home in their own room.
And then another one here on the testing. Many people are concerned about the lack of availability of actual testing, and sounds like there's been some cases and some other concerns now that we have a case in Mattawa. I'm not sure if that's counted in Yakima County or how that fits in, but can you expand a little bit in the actual process of receiving testing for the virus? How long does it take to get results, and what our options are right now?
Okay. Yes, this is a serious problem. And it has been frustrating for health providers and for people who are sick alike. There has been a very bad track record of people getting promptly tested, and then even if they do, it has been taking several days in order to get the results of the test, sometimes more than 3 to 5 to 7 days. This should be changing rapidly over the next week as the materials are distributed through the health departments and through private companies to clinics and healthcare provider offices. Yes, it is worrisome, and it has been one of the reasons why in our country, all over the United States, we have not been able to have as clear a response to knowing how to isolate people and when, what to do, because we have not had a good handle on the numbers of people who have the disease. So for right now, if you are feeling frustrated, yes, you have a good reason to feel that way, and most of us, many of us who are public health nurses and public health providers and people who are primary care providers, like in your doctor's office, everybody is very frustrated, and we are hoping that that changes soon.
Okay, I think we're down to one of our last questions, and just about traveling and any recommendations for traveling. Should people absolutely not travel?
Do not travel. Stay home. Stay home in your own home.
Regarding testing, Dr. Nyirati, the question they made before, since we have been unable as a nation to do as much testing as we should, would it be correct to assume that the best we can do then is to be as cautious as we can and err on the side of safety and keep our distance and all that just in case?
Exactly. Dr. Sun's making a very good point here. Since we do not have a way of preventing the viral spread right now, other than good hand washing and surface cleansing and disinfecting and keeping our hands away from our faces, we really do need to be extremely cautious. It's hard to get tested, and the best way to keep this from spreading is to be ultra cautious. Stay home, do a lot of hand washing, keep your distance from people, do not travel. There are a few other preventive things that you can do. Number one, get enough rest and sleep. We know that adequate rest and sleep is very restorative to the immune system and can actually help your body mount a defense against the disease if you have been exposed to it. Eat really nourishing, well-balanced meals. Make sure you get dietary vitamin C every day. That includes oranges and grapefruits and other fresh fruits that are citrus. Make sure that you eat adequate vitamin C and protein and vegetables, and get outside and take a walk. Being outside is good for you. Getting vitamin D from the sun and walking around in the fresh air is good for your immune system. And think good, loving thoughts about yourself and others.
And I know that you've got another appointment coming up. Just one last question, and I think this is probably definitely a technical question for you on the sensitivity and specificity of the screening. So you got some of your students on here, I think, that are making sure they're ready for the next quiz.
Yeah. So sensitivity is how we judge if we do a test, any kind of a test. Sensitivity is how good is a test at picking up something that's really there. Specificity of a test is how good is a test at detecting false negatives. The problem with the screening tests up until now is that they've been pretty good at picking up the virus if it's really there, but really bad at knowing if there have been a lot of false negatives. Lot of false negative tests, and that is dangerous because people get the false reassurance, but there's nothing wrong with them, that they don't have this virus. And that is why the initial tests that were on the market in December and in January and in February were rapidly pulled off the market, and the scientists had to go back to work.
Excellent.
The new tests that are being developed or have been developed have very good both sensitivity and specificity.
Awesome. Well, we want to thank you so much for your time. This will be recorded and posted, and we also will make sure that we have already started the process of looking at offering this same session in Spanish for our community, and you will be hearing more about some of our online Facebook Live sessions where people can ask questions. And so we're going to keep up navigating this new terrain. But before we log off here, I want to invite Dr. Sun, President of Heritage University, one more time to provide a closing for those of you that might have missed his introduction. So thank you so much.
You probably heard my voice in the background. I'm Andrew Sun, President of Heritage University. And I would just like to thank Dr. Nyirati for her providing her expertise to us. And as Dr. Hill said, this information will be available. It will be on our Facebook page. And also that we will have other sessions addressing different issues that are impacting our campus, such as the question as to what resources we have in order to support our students during this period. So please keep on looking at social media, keep on looking at your emails. Very important for Heritage students. If your email box is full, please empty it, because we are sending information to you. And I've already sent some emails that I get bounced back from students because their boxes are full. Please spread that word to anybody you know. And stay in touch. We will be working together to overcome the difficulties we are facing with the spread of the coronavirus. I am sure that all of you will be successful this semester if we all work together. Thank you very much, and until the next time.
Thank you, Dr. Sand.